Okay, so let's talk about the systemic phase of inflammation. So the systemic phase is really talking about the entire body's response to inflammation. So if you just have a tiny splinter at the end of your finger, that's going to cause local inflammation. If you have a splinter at the end of your finger and now your fingers become infected and then your hands become infected, that's going to generate a bigger response, and that's going to be the systemic phase of inflammation. Okay, so it can occur from an infection or any form of ongoing inflammation. So the signals have made it into the bloodstream and have alerted the whole system that that inflammation is occurring in the bloodstream. Okay, so it can be very short-lived, say with an infection that's cleared by the immune system, or it can be long-term, with such as with an autoimmune disease that keeps on generating inflammation, such as with asthma or lupus or rheumatoid arthritis, where there's constant production of antibodies and inflammation because of this autoimmune attack on your own organs. Okay? And the systemic phase typically leads to fevers, feeling systemically unwell. So you have muscle aches, weakness, joint pain. A lot of systemic symptoms are what you get when you have a viral infection, right? When you have the common cold, you get fevers, you get systemic symptoms because the virus has gotten into your system and is causing inflammation throughout the whole body. Leukocytosis is elevated white blood cell count. So whether in inflammation or in infection, you can have an elevated white blood cell count. Plus, you get inflammatory markers that are increased in the bloodstream. And there's one called ESR, so erythrocyte sedimentation rate, or CRP, which is C-reactive protein. And they're made in the liver, and the liver is producing these proteins that are part of, that we use as inflammatory markers in a blood test. So if we want to know whether there's a lot of inflammation taking place in someone's body, we can order an ESR or a CRP. Okay? So the systemic phase is really caused by all of those mediators of inflammation that we've spoken about: prostaglandins, cytokines, and leukotrienes that have gone into the bloodstream and have caused systemic inflammation and has activated inflammation in the bloodstream and throughout the body. Okay, so let's talk about a couple of these systemic manifestations. So fever would be a systemic manifestation. So we don't really know the exact reasons for developing a fever, but we think it's one way the body can respond to make an environment where infections don't want to thrive. Okay, so normal body temperature is usually between 36 and 37. Okay, somewhere in there. But with bacterial infections or viral infections or inflammation in general, you release interleukins, prostaglandins through the inflammatory cycle. Okay, those are being released by your macrophages and your neutrophils, and going into the bloodstream will get to the hypothalamus, which is a part of your brain that we'll learn about in another module. And the hypothalamus is responsible for controlling the level of your body's temperature. And these chemicals can reset the thermostat to a higher level. Okay, so any kind of inflammation or infection can lead to a fever. So you could have a heart attack and have a fever. You could have leukemia, and there's lots of inflammation with cancers, and have a fever. And that's why I mentioned with lymphomas in another module, you can have night sweats because it's a form of cancer. Autoimmune disorders. So all of those disorders that I mentioned, such as rheumatoid arthritis, lupus, Crohn's disease, ulcerative colitis, there's active inflammation going on and fever can occur. Medications can cause fevers. So if you have a sensitivity to a medication, you can have a medication-related fever because of the inflammation it caused. So basically anything that causes inflammation in the body can lead to a fever. So fever doesn't always mean infection. It can occur very commonly in infection, but fever means inflammation. Okay, so let's just have a look at this side view of half the brain here in terms of fever. So on the left you see that there's interleukins, tumor necrosis factor, prostaglandins not mentioned here, but prostaglandins as well go to the hypothalamus, and there's a resetting of the temperature of the regulating center of the brain, which is the hypothalamus. Okay, so through the autonomic nervous system, which comes from the brain, you can raise the body temperature. So how does it do that? Well, it can conserve heat by vasoconstricting, so closing down the blood vessels in the skin, which is going to reduce the release of sweat. And that's one of the ways we release heat, is by sweating, right? So that's going to conserve heat within the body. Okay, how can we generate more heat? Well, by muscle contractions or shivering will generate more heat in the body, and that's going to result in a fever. So vasoconstriction of the skin blood vessels, so that's why people with fevers often look a bit pale. They have vasoconstriction of their cutaneous blood vessels. They're not sweating as much, and that's why they get shivers and chills, because they're generating heat by the muscle movement of shivering. Okay? Okay, so let's look at this one. Slightly different, still a side view of the brain. Number one, release of a prostaglandin or a fever-producing cytokine from inflammatory cells. So that's prostaglandins, that's tumor necrosis factor, and interleukins. Okay, they go and through the bloodstream they get to the hypothalamus and cause a resetting of the thermostat to a higher temperature. Okay, so what are the responses that can raise the temperature in the body? Well, we just went through that. Vasoconstriction, so you look a bit pale because you have less blood going through your skin. Shivering, the little hairs on your skin are raised, called piloerection, and increased metabolism in the body, all leading to a fever. How can the body reduce the fever? Well, vasodilation in the skin will reduce the fever by releasing heat. Sweating will reduce the fever by also releasing heat in the sweat. And breathing faster because you're breathing out hot air. Okay, so this is just a bit of information on how a fever occurs. It's from the inflammatory system. And what does it do to the body to raise the temperature, and what can the body do to reduce the temperature? Okay, so we're still on fever here, And remember, fever can come from infection or inflammation, or both, or either. So it's just a response to inflammation. And you have different stages with fever. So there's a prodrome stage where typically you just have mild aches, pain, malaise is just the general feeling of unwell, and fatigue. And we've all had this with the onset of viral illness. And then that it'll lead to chills, right? So chills are coming from your muscles that are contracting a bit, that you're shivering. You have piloerection, those little hairs on your skin. So that's leading to chills. That's going to generate a higher fever, followed by flushing. What's flushing going to do? So once you have a fever, you feel flushed. That's from vasodilation, from now trying to release the heat, right? So the skin is warm and red, and by vasodilating, the body is trying to release some of its heat. And defervescence is really the onset of sweating. And sweating is another way for the body to release heat. Okay, so prodrome, something's happening in my body, got a low-grade fever, I feel generally unwell. Chills, that's generating the heat, the fever, and the shakes that can occur with fevers, followed by flushing and defervescence to try to reduce the fever. So here's some manifestations of someone who has a fever. So lack of appetite, very common, right? Or the medical term anorexia. So very common in fever to really have a reduced appetite. Myalgias, which is muscle aches. Arthralgias, achy joints. Fatigue, don't need to explain that one. And by the way, these are all from circulating cytokines, right? All those inflammatory markers, such as prostaglandins, tumor necrosis factor, interleukins, they're all making you feel this way, right? So it's actually your inflammatory cycle that's making you feel this way. Okay, fever can also cause an increased heart rate, right? So you're often tachycardic with a fever. In general, not that you need to know this, but for every 1 degree of temperature elevation, your heart rate typically goes up by 10 beats per minute. Okay? Your respiratory rate increases to try and breathe out some of the hot air. You often have sweating. That's your body's way of getting rid of the heat. Chills. That's your body's way of generating heat. They're at different stages, of course. Headache from having fever. Irritability. Dehydration, because you're going through more fluid. You're sweating more. You're breathing out more humid air. And remember, extremes of age are much more prone to dehydration with illnesses and fever. So small children, they don't have a lot of fluid to lose. Older people, they don't tend to maintain hydration. They don't have the same reserve in terms of their organs, so they can become dehydrated more quickly. Okay? So always think of the extremes of age when we're talking about the immune system as well, right? So little tiny children, neonates, young children under the age of 1, they don't have a fully developed immune system. Old people, their immune system has started to weaken, so they're more prone to infections as well. Okay, so we're still on the systemic effects of inflammation, right? So the body as a whole, its response to acute inflammation, Well, fever we just spoke about, right? And typically, just depends which textbook you look at, but typically a temperature of over, well, some textbooks will say 38 is a temperature. Some will use 37.8, just depends on which textbook. And fever will cause tachycardia, right? Increased pulse, increased blood pressure, the chills, anorexia, all those symptoms we just went over. It can also cause a leukocytosis. Leukocytosis is another word for increased white blood cell count. Neutrophilia, elevated neutrophils, as the portion of the elevated white blood cell is mostly, say, neutrophils, that would be in the setting of a bacterial infection. So if we see an elevated white blood cell count and most of the elevation is from neutrophils, and in particular, there's what's called a left shift, which is what we spoke about when we spoke about bands. That is very concerning for a bacterial infection. Okay, so elevated neutrophils as part of the elevated white blood cell count, and in particular, band formation on the blood test, concerning for bacterial infection. Lymphocytosis. So the lymphocytes are elevated compared to what they usually are. So you have an elevated white blood cell count, and most of the elevation is from lymphocytes. That typically points to a viral infection. And if we notice, this is relatively uncommon, if we notice an eosinophilia, so that small portion of the white blood cells is elevated, then that points more to a parasitic or allergic reaction. Okay, so when we get a white blood cell count back, it tells us what percentage are neutrophils, what percentage are lymphocytes, and so on. Okay, so we look at what's called the white blood cell count as a whole, and also the differential of the white blood cell count, which is the breakdown of all the white blood cells. And the ones that we look at the most are neutrophils and lymphocytes. Okay, acute phase protein production in the liver. So remember, during inflammation, the body wants to upregulate all of its proteins in case you bleed too much, so you make more clotting factors, which is one of them is called fibrinogen. You make more inflammatory proteins that we can check in the bloodstream. One's called CRP, C-reactive protein. One's called ESR, erythrocyte sedimentation rate. Okay, those are telling us there's inflammation occurring in the bloodstream. Okay, so let's talk a bit about leukocytosis. We're still on systemic manifestations. Remember, leukocytosis, elevated white blood cell count as a whole. Normal white blood cell count as a whole, all of them together, 5 to 10,000 typically. Different labs will give you slightly different numbers, say 6,000 to 11,000. There's always slight differences, but in general, 5 to 10,000 is a normal white blood cell count. Okay, so a leukocytosis, which is an elevation of a white blood cell count beyond 10,000, can occur with infection or inflammation, right? Okay, increased neutrophils we just spoke about. If the white blood cell count is elevated, say, to 15,000, and most of the elevation is from more neutrophils, that's a very strong indication for a bacterial infection. And if we see immature neutrophils, which are called bands, or another term is a left shift, and the left shift means they're coming out more and more immature as opposed to mature neutrophils. That's an indication of a severe bacterial infection. Okay, increased eosinophils as a big part of the leukocytosis. Parasitic infections or allergies can cause that. Increased lymphocytes, which would be the second most common scenario on this slide. Increased neutrophils being the most common in bacterial infections. Increased lymphocytes in the setting of an elevated white blood cell count, that often indicates a viral infection. So the lymphocytes go up quickly in viral infections. Okay, so let's talk about inflammatory plasma proteins. And we've already mentioned and spoken about many of these. So increased clotting factors, increased inflammation markers such as ESR and CRP that we can measure in blood tests that indicate the presence and the extent of inflammation depending on how high these markers are. Okay, and let's just talk a bit about some of these systems that are just plasma proteins, and they're all produced in the liver in the setting of inflammation. So the complement system is just a small series of proteins, and what do? Well, they will increase mast cell degranulation even more, so causing more histamine release. They're going to release more cytokines from say neutrophils and macrophages to attract even more cells. They're going to be part of a process called opsonization, where these little complement proteins attach to foreign substances such as bacteria, and they tag them. And once these foreign antigens are tagged, the immune system can now identify them for phagocytosis and destruction. Okay, so the complement system is just a part of the inflammatory system that helps in the process of ramping it up, of releasing more cytokines from neutrophils, releasing more histamine from mast cells, and tagging foreign substances in a process called opsonization. Okay, and here's the process called opsonization by the complement system. So you have a bacteria at the bottom there, and the complement system, which is made in the liver, these little tiny proteins, attach to the bacteria, and now the system, the inflammatory system in the immune system, sees them as even more foreign, and they can bind them much better. So the complement system helps the bacteria stick to, say, a macrophage and get engulfed and phagocytosed by the macrophage. Okay, so the complement system is just a series of proteins to help in this process of destroying foreign matter or bacteria and viruses. Okay, so just another image of the complement system. There's a microbe at the top there, say a bacteria, and what's going to happen? These little tiny proteins called complement are going to attach to the bacteria and make macrophages and neutrophils aware of the fact that, hey, this is a foreign substance, please destroy it. Okay, so by attaching to the bacteria, it opsonizes it, and it allows macrophages and neutrophils to engulf it and destroy it. Complement system also increases the inflammation because it releases even more histamine from the mast cells, causing even more vasodilation and tissue edema. Okay, so really they're just a series of proteins to help upregulate the inflammatory system. So we call all of these proteins that are increasing during inflammation acute phase proteins. And the complement system we've spoken about, the two that we can check for in the bloodstream is CRP and ESR. What do they tell us? They just tell us that there's inflammation occurring, right? It doesn't tell us where the inflammation is coming from. It just tells us that the liver is producing um, proteins that we can check in a blood test, CRP and ESR, in the setting of inflammation somewhere in the body. Okay. What about coagulation proteins? Well, we spoke about that. Because there's inflammation and potential injury, the liver makes more clotting factors in case they're needed for clotting and forming a fibrin clot, right? So say you fall off your bike, you tear open your leg and arm, and you're bleeding. The inflammatory cycle turns on. It sends a signal to the liver to make a complement system that's going to be involved in helping out to release more histamine, to opsonize foreign antigens, and it's also going to send a signal to increase clotting factors to help stop the bleeding, right? And common clotting factors such as fibrinogen and other clotting factors are released. Okay, so these are often elevated in inflammation or injury. And here's another system called the kinin system, or one of the molecules in this system is called bradykinin. And this is not a really well understood system. Again, it's a group of proteins made in the liver, and they play a role in inflammation, right? So kinins stimulate the release of even more cytokines, interleukins, and tumor necrosis factor from those cells that we've spoken about, such as macrophages and neutrophils, right? Which then allows more vasodilation and more permeability from the blood vessels to bring in even more fluid. So think of these systems as just a system of proteins to upregulate, to increase the inflammation, okay? And these proteins are made in the liver. Almost all proteins that you can think of are made in the liver. It's the main factory of the body, okay? Bradykinin is just one example of a kinin. That's all it is, and it's an inflammatory protein that also will increase pain in the setting of inflammation, just like prostaglandin will increase pain sensation because it's stimulating those sensory receptors, those little nerves in the tissue. Okay. Okay, so when we look on the left side here, so we're going to talk about systemic effects of inflammation. So say you have a rip-roaring pneumonia, and the mast cells and the macrophages and the neutrophils that aren't labeled there are releasing all of these cytokines into the bloodstream. Some of them are going to affect the thermostat of the body and lead to fever, lack of appetite, fatigue. Some of them are going to go to the liver to say, okay, I need more protein synthesis. So that's where you get your elevated complement, your elevated clotting factors, your increased ESR and CRP that we can check in the bloodstream to show that there's a lot of inflammation occurring. And also these cytokines, remember cytokines are just communicating molecules, that's all they are. Some of them will go to the bone marrow and tell the white blood cells to increase production, to have an elevated white blood cell count. Okay, so that's how you get these effects of leukocytosis and fever from these communicating molecules that are going to different parts of the body and elevating the fever, increasing more proteins, and elevating the white blood cell count.